joining us today. I am just so impressed at you being proactive to be here and learn more about how to manage your health today. We have so much exciting information to share with you. And my goal at the end of the day is that you can walk away with hope and an action plan on how to better protect yourself from coronavirus, from stress, dealing with anxiety, dealing with fatigue. And we deal with these things all day long, every day. So we're going to get going and dive in here. I'm Dr. Loy Anderson. I'm the owner and founder of Thrive in Functional Medicine. And I want to invite you to meet the rest of our team. Over here on the left side of your screen, we've got Quincy, and next to her is Jackie. Quincy is our health coach, and Jackie in the front is my office manager, and she's on with us today helping to moderate. So if you have questions or having any technical issues, type into the chat box, and I'm going to just have you test your chat right now. So just give me a hello if you can hear me and if your chat is working so that I can see you. You know, we're used to meeting with people face to face and we are missing that, but we have found that it's so important. Hi, Christy, that it's so important that people find solutions to their health right now, that we're working to meet you however we can. And right now it's virtually so that everyone can stay safe. Hey, Michelle. So next to Jackie, tall brunette in the back is Callie, and she's our other health coach. And next to her, the tall blonde is also Callie. Yes, we have two Callies. Callie is our administrative assistant. She manages our front desk. And then right in front of her is Melissa with that beautiful smile. And she is actually helping out at our front desk today, filling in. So and then of course I'm over here. You know, we started Thrive in Functional Medicine 3 years ago as an alternative to people who had been losing hope in the traditional system. And I practiced traditional medicine for 20 years, and I am not here in any way to put that system down. It's vitally important for managing critical care and acute care and injuries. So what functional medicine does is help you find the root cause and look at the underlying problem so that you can really come back to hope and health. And that's what we do here, and we love it. We're dedicated to helping people regain their health. And that's what we're talking about today. So I want to make sure that you're in a safe place. If you're driving and listening, maybe you shouldn't be. If you're at home and trying to wrangle kids and manage homework and working from home, I get it. It's so chaotic and overwhelming these days. But if you can set aside distractions, if you're driving, tune into our webinar next week or get a recording, because I don't want anyone to be unsafe. But set aside those distractions. There's so much going on right now. And for the next 45 minutes or so, I'm going to share with you as much information as I possibly can. But I want to ask you, are we drowning in information? I think we are. What we really need is information that will help you. And that's what we're going to talk about. So if you can just stay tuned in with me here, it'll help. And at the end of the day, you're going to have an opportunity to take action. So what we're covering today, we're going to talk a little bit about coronavirus. I know some of you are still wondering, how do I protect myself? What do I do about this? I'm going to share what we know for sure about coronavirus. We're going to talk about the American healthcare crisis and why it's contributing to the things that you're dealing with. And I know some of you are dealing with things that have been going on for years and you've been trying to get help and just not getting help. We're going to talk about what stress is doing to us right now. Who's feeling stress? Type yes in the chat box if you're feeling some stress. If I could type and talk, I would, because I'm feeling some stress these days. And we're going to talk about the keys for helping fix anxiety and fatigue. And you guys already know this. The keys are not more medication. So that's what we're going to be talking about today, and how to fix these things naturally and holistically. I just want to be right up front. You are going to have an opportunity to learn how to book a free 20-minute call with us at the end of our presentation today. If you're interested in learning more about our approach and feel like maybe you could benefit from our help. So stick around. Yes, Esther, I get it. We are all dealing with stress, but we're going to share more about how you can book that free 20-minute call and also get a gift. So stick around. We're going to move fast and get through as much as I possibly can. And I want to start right now by sharing with you what my why is, why I do what I do, and why I'm doing functional medicine. On a Thursday evening at 2 a.m., my phone rang. This was a number of years ago when we still had phones that rang. And you know, when the phone rings at 2 a.m., it's never a good phone call. And I woke out of a sleep and I picked up the phone and I heard my mom's broken, halting voice on on the other end of the line, and she said, "Your dad didn't come home tonight." Now, my parents were in overseas, and my dad was a mission pilot, and he was my hero. He was my mentor. He's the one who inspired me to go into medicine, and he was very healthy. And at the time, he was only 58, and we didn't know what had happened yet, but he was flying that day. And in New Guinea, it was Friday afternoon, and he was on his last flight of the day, almost home, and he never returned. And I had to wait 12 agonizing hours waiting to know what had happened. And then I got the news that we were all dreading, that he was gone. That day was 18 years ago, and it's still like, it feels like yesterday. Why I'm sharing with you this story is because we could not figure out why he crashed. He was a very experienced and skilled and careful pilot. There was no mechanical or weather-related issues. And as anyone who's gone through this kind of a loss, and I'm sure you've all lost people you love, we started asking ourselves questions. What happened? Why did this happen? And in hindsight, which they say is always perfect, right? There were so many clues that he was having health issues. He was experiencing things like fatigue and brain fog, anxiety. He was feeling he was under a lot of stress, but he was having joint pain and headaches, and he was getting more and more short of breath on hikes. And when I look back, it all points to a picture that some of you might be familiar with. He was dealing with some thyroid issues. Now, like some people on watching today and people that we talk to every day, he went to the doctor. He said, "I don't think things are right. Something is wrong. Can you please find out?" They did tests and they said, "Well, it might be your thyroid, but let's just wait." You guys, it was too late for him. It was too late for me. It was too late for my mom and my brother, but it's not too late for you. And that was the day that I started asking the question, why? Why did this happen? Why did he not get the help? Why was he sick? And nobody could figure out why. Have you felt like you know something's wrong and you don't know why? Just type "me too" in the chat box if you're feeling in that boat. And that's what inspired me really to search for and find the functional medicine. Jean says "me too." Functional medicine keeps asking why until we figure out what's the underlying problem. And like one of our clients, Marita, shared with me just yesterday when I saw her, "Esther, me too." She said, "I finally realized I wasn't crazy. There was something wrong. We just have to keep asking the questions." So who is depending on you? Who else is your health affecting? Because here's the thing, my dad's health didn't just affect him. It affected my mom. And in the graduation cap in this picture on the right is my mom, who went back to school after my dad passed away and finished her college degree. It had always been her dream, and she didn't have a chance to finish that early in her life. She didn't let that stop her. But now my daughter on the left and my dog Maya bring light and joy into my life. They depend on me. My mom depends on me. And that's why I invest in my health. And I feel like that's what makes me an authority and gives me the right to share with you today about how to reclaim your health. Yes, I have the MD degree and the training and the functional medicine certification. Those things are important. But what's even more important is that I am passionately dedicated to maintaining my own health and helping you with your health. Because honestly, guys, without our health, how can you live your purpose? How can you be your best self? And that's our purpose in life at Thrivin, is to help you live your purpose with having abundant health. So guys, I'm so glad if you just joined us. Welcome, Jean. I'm going to share a little bit about coronavirus. You might be sick to death of hearing about it, just wish that everything would go back to normal. I can tell you guys, coronavirus isn't going away anytime soon, and we're going to find a new normal, but we're never going to go back to the way it was. The biggest question that I find people asking is, how do I protect myself? And how do I protect others? So wearing a mask, wearing gloves, those are good steps to take. Social distancing, staying home like this so that everyone's safe. Those are all good steps to reduce the transmission and protect other people. Here's the bad news. Those steps are not protecting you. So what I want to talk about is who's at risk and what can we do about it. So coronavirus is actually not a new virus. It has been around for a while. This particular strain is new. And what we know, this is from Dr. Catherine Kadzierska, who's an immunology researcher in Melbourne. She said that basically, if you have a healthy immune system, coronavirus is not going to be a problem for you. The bad news is 2 out of 3 Americans now, including young people, even kids, are not healthy. They're facing some kind of health challenge or immune compromise, and it's just getting worse and worse. So at least 2 out of 3 of us have increased risk factors for coronavirus. And those risk factors, the defense of coronavirus is really dependent on your immune system. In this talk, we don't have time to go into that. But I'm just briefly going to tell you that when your immune system is healthy and balanced, you can fight things like coronavirus. You can decrease your risks of autoimmune disease. You can protect yourself from cancer, from Alzheimer's, all the things that we dread and fear the most. But when we live in our modern society with all the threats to our immune system, and we're going to touch on a few today, everything gets out of balance and your immune system doesn't function normally. And that's when you're at risk for not only coronavirus, but all those other things that we do our very best to avoid. So getting back to coronavirus, we know that it's not just people who are older. We thought that maybe that was a risk factor, but it's not just that. It's people who have chronic health conditions, including being overweight, including heart disease, blood pressure, diabetes, lung disease. Those are the people that are having the most serious problems from coronavirus. So what do we do about that? Right? What do we do about that? Well, what you've got to do is learn how to control your risk factors. And that's what happened with Dwayne. I'd like to introduce you to Dwayne. And he came into our program knowing that he was in the high risk category. He was in that category that, sorry guys, I'm trying to find my slides and they're not showing up here very well. Here we go. I'm still learning all this new technology, and they say that keeps our brain young. So I wish you well if you're learning how to do things in a new way, whether it's homeschooling your kids or work from home or whatever it is. Anyway, my sympathies. Dwayne came in being very overweight, diabetes, heart disease. In fact, he just had open heart surgery. So he was in one of the high risk categories for coronavirus. By learning how to implement the changes, and this is what he said, I love it, he was able to dramatically reduce his health risks and no longer be in that high risk category. So he was able to get off medication, lose weight, get his diabetes, not just managed, but cured by changing how he was living. So super proud of Dwayne. And I want you to know it's possible to get out of the high risk category. And by doing all those things, not only did he lower his risks, he boosted his immune system, which is the very best way that you can protect yourself. That's what we know for sure about coronavirus. So when it comes to coronavirus, we can't eliminate the exposure, but you can absolutely start by getting proactive. And you guys are like the many people we work with. You're proactive. You've joined us today to start learning what you can do. Get the right information and learn what to do about that. We talked about reducing the risk factors, and functional medicine's all about finding out the why, the underlying factors, and boosting your immune system. Minimizing stress and inflammation are keys for boosting your immune system, and we're going to talk about that. Most importantly, you've got to take action. Otherwise, nothing's going to change. Guys, if you've just popped on, thank you so much for taking the time to be here today, for being proactive about your health. We've just talked about what we know for sure with coronavirus, and I want to dive into a little bit of the American healthcare crisis now, and why my dad did not find the answers he needed in time, and why I'm here to help you find the answers so that it's not too late for you and your family. If what you hear today is resonating and you want to learn more about what it looks like to work with our team, you'll have an opportunity to book a free 20-minute call at the end of our seminar today. So stick around. Let's dive in and talk about the American healthcare crisis. I'd love to hear your opinion. Do we have an American healthcare crisis, a health crisis, or both? Just type in the chat what you think. I haven't yet met one person who doesn't agree that we have some sort of a crisis going on. And it's actually kind of a trick question, because the answer is both, Jean. Exactly. And Anita and Esther. It's both, right? So what is contributing to the terrible outcomes? So here's just a few numbers. Sometimes these just go right over my head and don't even register, but try to let these soak in for a minute. We spend as a country 3.5 trillion on healthcare every year. And 90% of that goes towards chronic health diseases, not accidents or injuries or crisis, but chronic health disease. 5 out of 6 adult Americans have a chronic health disease. It's more than twice as much as any developed country. And 70% of all deaths are caused by those top 5 chronic diseases. Healthcare expenditures are the number one cause of bankruptcy. And yet we're number 37 out of 40. That's appalling in health comes in the developed countries. So would you agree with me and say that these are unacceptable costs and unacceptable outcomes? I think so. And I hope that's why you're on today, because we can change this. We can change this, but we're going to explore a little bit more what's driving this. So one of the things is the almighty dollar. We know that's a contributor to all problems, but wrong or lacking information. Do you think we have wrong or lacking information? Again, sort of a trick question. I guess I like those. We're drowning in information, but we're starving for the right information, right, Esther? Exactly. We need the right information for you, because each person is an individual and a unique person. But one of the things that you're getting wrong information about is what your insurance is doing for you. You've been taught and trained to rely on your insurance, that little card in your wallet that you're probably paying a lot for, maybe $6,000 or $8,000 for your deductible, maybe several $100s a month or thousands even for your premiums every month. You're told that that's going to keep you healthy and keep you well. Well, let's talk for a minute about what insurance pays for. What do you guys think it pays for? I'm going to keep going, but I want to share, while you're thinking about that, what Medicare says about wellness. Medicare says, and this is a direct quote, care that seeks to prevent disease, promote health, and prolong or enhance the quality of life is not considered medically necessary. Does that make you just want to pull your hair out? It should, because not medically necessary means they're not going to cover it. Now, if you're thinking, well, good, I don't have Medicare, here's the bad news. All insurance guidelines go off of Medicare. Basically, what your insurance is going to pay for is prescriptions or pills and procedures or surgeries. And all of that, it is terrible. Exactly, Esther. All of that is designed to manage disease. None of that is designed to help you create health. Now, when I went to medical school, I thought that learning to be a doctor, I would know how to help people get healthy. But I don't. I didn't learn that. I learned how to manage disease, and they are two different things completely. Exactly. There's no relation between those two things, as Craig said. So your health insurance is really not health insurance. It should be called sick insurance. It's to ensure if you do get sick. But what are you doing right now to actually ensure that you stay well? Unfortunately, what's happening is the traditional medical system does this. Okay, you're not feeling well. You have a symptom. We call that a diagnosis. And then we provide a solution, and it's a prescription. So I've worked with so many people, and this is kind of a typical pattern in what we're talking about today. You can't sleep, so you get some Ambien. Then you're tired, so you get some Provigil. You have brain fog. Well, we can use some Adderall for that. Now you're having weight gain? Oh, shoot, there is no drug for that. Wait, there used to be, but they were causing heart problems, and we had to take them off the market. So why don't you try to exercise more and eat less? Who's tried that? We're going to talk about if that works or not. Well, you guys already know it doesn't work. Well, now you have heartburn because you're overweight. You can take Nexium for that, which, by the way, all of these things cause all kinds of other problems. Now you have joint pain, So take some Motrin. And at the end of the day, you have so much anxiety, you don't know how to function. So you get on some Xanax or some Paxil. You guys, anxiety is not a Xanax or a Paxil or a Lexapro deficiency. It's an imbalance in your system, and we're going to talk about how to fix that. Can anyone relate to this? Have you experienced this? So we work with people who experience this all the time, and I'm going to introduce you to Kayla in just a second, but this approach leads to another part of our healthcare crisis, which is big pharma and pharmaceuticals. The pharmaceutical industry wants to create clients for life, not cures. If you're on a blood pressure medicine, how long are you going to take that? Forever, right? Is that curing you or it's not? Yeah, we work with people all the time, Esther, that are on this downward spiral. And that's why I'm here doing what we do, because it's possible to get out of this spiral. This approach is like managing your check engine light by putting a sticky over it and just covering it up and saying, I can't see the problem anymore. Your medications are covering the symptoms. I'm going to go back here. All of these symptoms are the body's check engine light coming on and saying, look, there's a problem. Please take care of this. And if we ignore the check engine light in the car, what's going to happen? Of course, we know the engine's going to blow up sooner or later. Well, when you take medication for your symptoms, like your diabetes or your blood pressure or your anxiety, the problem can continue to progress, not get better. Are you okay with that? I hope you are not. Kayla was not okay with that. She was having all kinds of problems. There's a lot of words that she shared. You can read those. But the bottom line is she had gone to the traditional medical doctors, and I'm not putting them down. They did what they've been taught to do, but they kept putting her on more and more medications, and she felt worse and worse. At the end of the day, when she had applied what we're going to teach you, she said, I no longer feel extreme tiredness or need a nap to get through the day. And most importantly, for myself, I have the energy to work full time and take care of my 3 children, because Kayla was a single mom. And that's what happened to her when she got out of that traditional approach and into the functional approach. And exactly, Jerry, anxiety can just push you right over the top. And we're going to dive into that next. So if you've just joined us and made the time to be proactive for your health today, thank you. We've talked about coronavirus and what we know for sure. We've talked about the American healthcare crisis and how that system is not helping you resolve your chronic health problems or learn how to be healthy. We're going to dive into what stress does to us now. And you know what? I have worked in functional medicine now for 3 years, and we saw people with high stress levels all the time. Now it's at another level, like over the top with stress. Whether you're working from home, whether you've lost your job, whether you know people that are sick, you're worried about getting sick, you're taking care of your parents, whatever it is, the stress is becoming unbearable. And we're coping through the day by drinking tons of coffee, or maybe we're just already flat out and just have been knocked over completely. Well, I'm going to talk for a minute here about what stress is doing and where it's coming from. So we can break stress down into 3 main sources. Physical stress is things like trauma and injury and surgery. It's even things like sitting, and we're all sitting more because we've been at home. That creates more stress in the body. Chemical stress is a huge one. All the medications that you're taking create chemical stress. All the toxins in the environment create chemical stress. And then emotional stress, we all are familiar with, and we can relate to the person who has a bad boss or a dysfunctional relationship or worrying about your kids. Here's the thing, guys. I work with some people and they say, well, I don't know why I'm stressed. I don't have any stress in my life. And what they're thinking of is the emotional stress. Well, you don't have to have emotional stress. You can have that chemical or that physical stress or an infection or inflammation. Those all create the same kind of stress signals that go to your brain and fire off signals to your adrenals. In the middle of this slide, on top of the kidney, is this little walnut-shaped gland called your adrenal glands, and that produces all these hormones that go to the rest of your body and tell the body how to react to stress. Well, that keeps us alive in a crisis, but it kills us when the stress is chronic. And we are all dealing with chronic stress, which is slowly killing us, literally, literally. So one of those symptoms is anxiety. And I've worked with so many people who feel like they're a prisoner in their own home because the symptoms are so severe. Jerry said it just feels like it pushes him completely over the top. So I want you to take a look at this next slide. Type into the chat box, what symptoms do you recognize on this slide? Or what symptoms do you feel like with this anxiety? Do you feel like somebody's grabbing your throat or sitting on your chest? It can feel awful, and I've been there. And you can feel so helpless, especially if you don't know what's causing it, right? So I want to introduce you to Stacy, because Stacy, who had just had a baby, come in to see us not feeling well. She had all kinds of health problems going on, including high blood pressure and fatigue and thyroid problems. But one of the big things for her was severe anxiety. And she wanted to take care of her new baby, Tristan, who was so cute. Oh my goodness, I should have a picture of him up here. But anyway, she was struggling with her anxiety and not even able to function as a mom. And by addressing all the underlying causes with a systematic plan I'm going to share with you, she said, my anxiety is gone and I'm so happy. She had told me in an interview, and I wanted to share it, but that's more technology than my brain can handle. She said, I've gotten my life back and I just feel normal again. So powerful. And that's what I love about what we get to do, is we get to hear people regaining their health. Esther said she's feeling the restlessness, the fear, the anxiety. Exactly. Can feel all of those things and more. So what did we do for people like Stacy and Kayla and Dwayne? Well, what we do is we help find the missing pieces, and these are the missing pieces, and we put them together in a systematic way that's doable and that helps you resolve the underlying cause. So we're going to touch on each of these just briefly, but I wanted you to, this is kind of the heart of what we're talking about today. This is the key for fixing the fatigue, the anxiety, the stress, the autoimmune disease, the heart disease. It's the key to everything. And when we're working on health, the same approach works for everything. When we're treating disease and managing disease, you have to have a specialist for every field because they're only working on the problem, not the solution. So we're going to start with nutrition, because that's one of the key foundations of creating good health. And I'm going to invite you to see what you're eating as actually medicine. Food is the most overutilized drug, and I'll explain what that means in a second, and the most underutilized medicine. What we eat to cope with stress and fear and anxiety, right? I've seen all kinds of memes on social media and Facebook about how should I go to AA first or Weight Watchers first when quarantine is over? Well, it's because we cope with stress by eating and drinking things that are not healing our body. They're actually causing harm. That's not your fault. It's your body's chemistry and wiring and what you've been conditioned to do by society. But when you eat the right kinds of foods that help your body heal and nourish you, it's actually medicine. So I love this quote from Wendell Berry. He says, people are fed by the food industry, which pays no attention to health. The food industry manufactures and scientifically studies foods to make them the most addictive as possible. You know that Lay's potato chips commercial, it says you can't just have one? They scientifically engineered it that way. But the health industry pays no attention to food. And so they're both going to be able to stay in business, which is a crime, in my opinion. So we're going to teach you how to start eating the right kinds of foods for you. We don't have the diet. We have your diet and a plan to figure that out. It's absolutely not your fault, Esther. It's because we've been taught and conditioned. You haven't gotten the right information. And Pain, Craig says, pain, PMR, which is polymyalgia rheumatica, such a painful condition, poor focus and fatigue. All of those things are so hard to deal with. Thank you for sharing that, you guys. Thank you for being open about your struggles here. What I found is that when we talk about our struggles, we can encourage one another and we can start finding solutions. So good for you. Kudos for that. So when we start learning how to eat right, we can also start, and our energy starts improving and our focus starts improving. Then we can start thinking about fitness. If you've been told to exercise more to lose weight, but you hurt too much and you're out of breath all the time and you can barely get through the day, let alone go out for a jog, we do things like this, right? We take the dog for a walk because we care about our pets. We care about our family members, our kids, our spouses, our parents, and we make sure they're taken care of. And we leave ourselves for last until there's nothing left and we can't even go for a walk anymore because it hurts too bad or we don't have the energy. But if we don't help you start learning how to build muscle, you're never going to reach hormonal balance or the physique that's going to give you confidence and self-esteem that you feel great about. And all of us deserve to feel good and look good. All of us. And it's possible for all of us. So those are the fitness and the nutrition piece. And I want to talk for a minute about the detox piece. And I just have to share with you a little story about Marilyn, who just came in yesterday. She hasn't had time to even really write anything down. But I want to point out on the top left corner was her picture when she first came to see us. And the picture underneath that was yesterday. And the key for Marilyn was working on detoxification and liver health. Now, she was having a lot of symptoms when she came in, like severe fatigue, not sleeping well, itching and pain all over her body. And all of the pieces are important, but for her, detox was particularly important. Her story, I just am going to share a tiny little bit of it. Her liver was so severely damaged that she ended up in full-blown liver failure. She was sent to the University of Washington, where they did all kinds of specialty testing, including liver biopsies. And they told her, there's nothing more we can do. We don't know why this is happening. We can put you on a waiting list for a liver transplant. We're going to send you home now. Can you imagine? She came in and we carefully, gently, persistently worked on all those missing pieces, and the biggest one for her was detox. And she came in yesterday looking almost unrecognizable and said, I feel like you've saved my life. And, she did the hard work. We just helped her find the path, but we were all patient. And I have to confess that we've shed some tears because we were at one point so concerned and worried about her. But that's what can happen when you find all the missing pieces. And it's totally possible. So if you've joined just recently or you're still hanging in there with me, guys, thank you so much. We've talked about coronavirus, what we know for sure. We've talked about why the American healthcare system is in such shambles and why your health is struggling and you're not getting the answers. We've talked about stress and anxiety and fatigue and what those are doing to our body. And we're really diving in now to those missing pieces that are going to allow you to recover and reach optimal health again. Like Marita, I mentioned her earlier on today because she had told me, I feel like I'm not crazy now. I know I'm not crazy. She told me yesterday, actually, she came in for her last visit and she said, my daughter and her friend just said to me, you know what, Mom? It feels like you got your life back. And she was just beaming. And that's what happens when you put all these missing pieces together in the right order and in a way that's doable. Like Dwayne said, a way that we can do it. So we're going to deal and help you learn about nutrition. And part of nutrition, which I didn't even touch on today, is your gut health. We have absolutely got to help you learn how to create and support optimal gut health as a key for everything, including anxiety and fatigue. But that's part of nutrition and detoxification is your gut health. We're going to look at and help you work on fitness. And today we don't have a lot of time to touch on hormones and the nervous system, but those are absolute keys that we take you through that process as well. So Linda is saying inflammation, weight gain, lack of energy, and anxiety. All of those are so hard to deal with. Yeah, guys. So how did we put all this together? How is it possible to be able to do this? If it sounds a little overwhelming or you're thinking, well, I can't do that, or how can I do this? I want to introduce you. It reminds me of Sue Peterson. She came in again with a lot of symptoms, including severe fatigue. Now, like a lot of our patients, Sue had already done a lot of her own research. She had already discovered some of the things going on, but she didn't know what to do about it. She was overwhelmed by information and starving for knowledge and guidance. So we helped her find the underlying problems. And by taking her through each step of this process, we guided her to help her recover. And this was her at the end. I couldn't find her before picture today. So, but she says, and I'm sharing this because I love what she says, we don't know what we don't know. We don't know what we don't know. And at the very end, I just love this. She said, humans are stubborn. And until they aren't, I wish them well. What she's really saying is that we have to be ready to change and willing to allow someone to help us. And that's the key to our whole program that we do here at Thriven is we provide that guidance and the mentoring to put all those pieces together. You're not stuck out there on your own trying to figure out how to put these pieces together. We help you, and we do that by treating the whole person. So I don't know a single person who plans to fail. There's not a single person I've worked with in over 25 years of practicing medicine that doesn't want to get better. But if you don't have a plan, you're probably going to fail. 94% of people fail if they don't have a plan. And if you've never even been given a plan, well, if you've made any progress, kudos to you. That just shows your determination and dedication. But imagine what can happen if you have the plan and if you have the support. It's kind of like learning to fly. This is me and my dad, and I'm a pilot as well. This was obviously a long time ago, before I lost my dad 18 years ago. This was actually one of the best days and memories of my life. And I'm a pilot too, and I love flying. But learning how to take care of your health and recover your health so that you can say, like Marita's daughter, I've got my life back again, or my mom's got her life back again. It's going to be similar to learning how to fly a plane. You're not going to just hop in the plane and take off, right, guys? Who's going to hop in and go somewhere if you don't know how to fly? You're going to have to study and learn and practice, and you're going to get in that plane with an instructor and fly hours and hours until you're confident and capable and equipped and qualified to be able to fly that plane on your own. And that's what we want to do with our program, putting together the missing pieces. We want you at the end of the day to be the pilot of your own health. We want you to be able to reach your destination and land safely, getting out and walking away with a big grin on your face because you made it. And you're going to need all those pieces in place and someone to help guide you through that process to find that solution. Now, you might be thinking, this sounds either too good to be true, or I don't think I can do that, or what's the catch here, or what is she trying to sell? You might be feeling skeptical, and that's how Nancy was feeling. Nancy came into us because she was dealing with very high cholesterol and worried about heart disease. She said, I was terrified, but she knew that she had reached the end of what traditional medicine could offer her. And she said, I was so skeptical, but by allowing us to help her go through this process and by bringing in the effort on her part, not only does she have the confidence to live with freedom and security, her cholesterol's the lowest it's ever been with no medication in 20 years. The plaque in her arteries, in her neck is going down, and she feels confident knowing how to take care of herself. That's what can happen. So we're getting ready to wrap up here, guys, and you've done so awesome hanging in there with me. I want to ask you a question, and here's the question. Are you willing to do something different? Sometimes we say, well, I want to feel better. I want to have more energy and less anxiety and lose some weight and more focus. But we want to keep doing the same things we've been doing. The same things that got you to this point are not going to get you to a new point. And so it's going to take coming to that place where you say, I am ready and willing to do something different. I just don't know what to do. So sorry, I got sidetracked for a moment. I apologize. When we put things off until tomorrow that we know we should be doing today, what do we call that? Right? We call it procrastinating. And Sometimes we're just not ready to get off the couch. I get it. It's rainy out like it is today, or it's snowing. Thankfully, it's not snowing today. And we're just not ready to move. But sometimes we have to hurt bad enough until we are ready. I want to ask you though, what keeps you specifically, Craig or Esther or Anisha, what keeps you from taking action? What keeps you on the couch? Well, many people tell me it's fear. We are afraid of failing. We're afraid of maybe succeeding. We're afraid of change. We're afraid of the unknown. We're afraid of pain. And we think that by staying in our comfort zone, that we're going to be okay. Do you know why it's called the comfort zone? Because it's so uncomfortable to get out of our comfort zone. But everything you want, the reasons you need your health, who's depending on you, your why, all of that is on the other side of our fear. And so you have to step through that fear if you really want to reach what's on the other side. And I want to ask you, what is it that is going to motivate you to step through your fear? And if you have a plan in place and you have the support, there's absolutely no reason why you cannot reach your goals. I don't know what's on your bucket list. I don't know what your why is, but you do. You do. And Esther says she wants her effort to actually work. Absolutely. Be able to have the purpose of going to a job and the financial freedom of a job. Those are so important. So you might be asking yourself, well, what's next? You know, we are used to doing live dinner talks where we can meet with you face to face and enjoy a delicious meal and answer all your questions. And at the end of that evening, we invite you to schedule a consultation. That's a 1-hour wellness evaluation with myself where we're going to sit down knee to knee for an hour and go over your health concerns, talk about a plan of action and what that looks like to work with us and get you going. Well, we recognize that these are very uncertain and strange and difficult times. So we are not asking you to do that. All we're asking is that you take the next right step. And that's why we've offered you an opportunity tonight, which we've never done today. I'm used to doing these at night, but it's noon. I forgot. We're offering you an opportunity to book a free 20-minute call, and we're calling it a discovery call. It's a chance for you to discover how we can help you and for us to get to know you a little bit more. We're going to talk about what you're going through. You've shared some of that already with us a little bit today, and thank you. We're going to talk about maybe what you've tried and maybe what are the missing pieces. Then we're going to talk about whether it's a good fit for you to come in and see us, and then you will have the chance to schedule that consultation. Now, that consultation is usually $287. When you've attended one of our educational events like this, we discount that to only $87 because I know, number one, you already have the background information. Number two, you're already dedicated and proactive in taking action for your health. And that's the kind of people that we want to work with. So after your free 20-minute discovery call, you will have an opportunity to book a consult with me. And that consult will be $87 because you've been on our webinar. We really want to offer you that opportunity and that hope to know that you don't have to just stay stuck in the broken system on that downward spiral, like Esther said. You can get out of it and you can reclaim your health. So those of you who book a call today, we're also going to, and there's the link in the chat box that Jackie's shared that you can just click on and book right into our calendar. With that 20-minute call, you're going to either be talking with myself or my PA, Anisha, or Jackie, and we're going to help you decide if it's the next right step. We don't want you to even have to leave your home or spend a penny before you decide whether you want to come in for a consultation. Now, we're still in this reopening phase, and if you decide you're going to come for a consultation, we can do it like this by Zoom. So you don't even have to leave your home. You don't have to worry about your exposure. Or if you live in Havre or in Helena or wherever, you can do it that way as well. However, we are in our office and taking all the precautions. So if you want to come in and meet person to person, we can do that too. Either way works, but you'll go over all of those details in your discovery call. Now, I want to give you just a little bit. I'm going to go back one slide here because one of the things we're going to do in your discovery call is help you also be prepared for your consult. There are some things that I require or ask of you when you come in for your consultation. Number one, you're going to get some paperwork that will be sent to you after your discovery call. It's very important that you do that and bring it in with you. That's so that I can really understand what your goals are and where you want to go with this. Number two, I'm going to ask you to bring in your spouse. Now, why would that be? It's because we have discovered here that the people who do the best are the ones who have the support of their spouse or their significant other on board at home. Now, so we're going to ask them to come to your consult with you. We also feel like investing in your health and making a lifestyle change is a team decision. This is going to affect your whole team. And so we want everybody to know what's going on and make sure this is the right fit for you. So plan to bring them. So I would encourage you to invite your spouse to join you on your discovery call too, or your significant other. If you're not married, guys, that's fine. But if you have somebody that you rely on to help you make decisions, or a significant other, if they can be with you on your discovery call, then you can both confirm the appointment for your consultation and know that you'll be there. So guys, I have a lot of common questions. I'm going to answer a couple of those. If there's any specific questions you'd like me to cover tonight, I said it again, this afternoon that I haven't covered yet, type it in the chat box. I want to let you get off so that if you need to get back to work or lunch or kids or whatever, you can. But I'll stay on and answer your questions if we need a few more minutes. You absolutely don't go have to find a spouse or significant other, Esther, and we'll make sure your link is working. But if you have somebody you want to bring with you as a support, you can do that too. So the first question that I usually get is, does insurance cover this program? Does insurance cover what you do? Do you guys know the answer to that question? We kind of covered it indirectly earlier on. Insurance covers pills and procedures, medications and surgeries. And what we do is neither. What we do is wellness. What we do is health. What we do is education. What we do is support. None of those things are covered by insurance because there's no billable codes for it. So it's not that we don't take insurance. It's more like insurance doesn't take you and they don't take me. So yes, so the next question is, well, what does this cost? Can I afford to invest in my health? I'm going to reframe that question for you. Can you afford not to invest in your health? What is it going to cost you if you continue to ignore your health? Do you know how much a nursing home for 1 month costs? A cheap one is about $6,000 to $8,000 a month. Do you know what it costs you to go to the emergency room for an episode of chest pain, which might just be anxiety? Several $1,000s. I have patients who come in and tell me they're on medication that costs $1,200 a month, and it's not even helping them. So you have to invest in your health. And this is an investment, which means it's going to continue to pay for the rest of your life. There is an investment for our programs, and I cannot tell you how much that is. That's the purpose of your consultation. At that consultation, I will know what you're going to need, and I will tell you exactly what that investment is going to be. And we have people that, like Kayla, single moms. We have retirees like Nancy. We have people on disability and fixed incomes. If it's important to you to recover your health, we are going to help you find a way to fit it in financially. We have payment plans and financing options. So it's really more about, is this important enough to you to find a way to make it work? Yes, you're going to have to be able to invest $200 or $300 at least into your health a month, but we have some ways to make that work. So I even have people in the last 2 months who've either been let go or had their hours reduced, and they say there's never been a better time for me to start taking care of my health. It's more important now than ever. So we will help you with that. And then a very common question that comes up on the discovery calls is, do I really have to bring my spouse to the consult? And I'm going to really ask you to bring your spouse or significant other, if you have one, to the consult to help you make the right decision for you. It's not fair to ask you to make a decision if they're not there supporting you. So that's why we do that. And yes, we're going to ask you to bring them. Now, if they're out of the country, we can do a Zoom consult. That's a possibility too, or out of state or whatever. So there's lots of options. I really don't see any other questions here. I'm going to just scan through the chat a couple more moments here and make sure that I've answered your questions. You guys, we are so passionate about what we do, and I love to share the stories like Marita and I'm having blanks here. I need to eat lunch. Stacy and Kayla and Dwayne and Nancy. That's the highlight of what we do here. And Marilyn, and I can't wait till you're one of those stories and that we have you inspiring other people and back to being your normal self. So book your book your discovery call. If it's the right step, we'll get your consult booked. And thank you for taking the time to be here. I know it's a crazy time. I think you all stayed on the whole time, and I'm honored. So we will see you soon, either on Zoom or in our office, and we are here for you and can't wait to get started. Bye-bye.